Good evening and welcome to Face to Face. For the Newsfirst team, I'm Yanushi. Well, heart disease is one of the most important factors in one's life anywhere in the world. But here in Sri Lanka, we really aren't paying enough attention to it, and we need to do so in order to live happy and healthy and long lives. And today it's my pleasure to welcome Dr. Yanushi Dullewe Wijeyeratne, who is a distinguished British Sri Lankan cardiologist who practices in London, and her specialty is heart rhythm disorders, inherited cardiac conditions, and life-saving cardiac devices. Good evening, Dr. Yanushi, and welcome to the show.
Thank you, Niresh, and thank you for inviting me here today.
Right. So this is not a subject which we've often covered on this show, but it's all important. And could you just give us an overview of the global and the Sri Lankan situation where heart disease is concerned, and the different types of heart diseases? Because in Sri Lanka we say, oh, he had a heart attack or she had a heart attack, but that's terminology which we used perhaps 50 years ago, and we really need to understand heart disease better.
Absolutely. Globally, heart disease is one of the biggest killers and causes a big burden of health worldwide in both young and older people. And there are fundamental two types of heart disease. There is acquired heart disease, where lifestyle plays a major factor, and there are also inherited heart diseases. And there can be different types of heart diseases. It could be disease to the blood supply of the heart, and that's where the term heart attack comes from. But there are also other causes of heart problems, which might be heart muscle diseases or primary electrical problems of the heart. And for example, if someone collapses suddenly, that's often due to a primary electrical problem of the heart. And that may or may not be caused by a heart attack. In older people, heart attacks are still the most common cause. But in younger people, heart muscle diseases and primary electrical problems are the main cause of heart problems. And that's often under-recognized.
Right. This is why you can have a perfectly healthy young man or woman, perhaps in their 20s, and suddenly they pass away, and it's such a tragedy, and it's such a shock to everyone, because it could be an athlete, it could be someone who's in seemingly perfect condition.
Absolutely. And that is emotionally it's a very tragic situation, because there may be no warning signs, or there may be warning signs that were often under-recognized. For example, that person a couple of years ago may have had a supposed faint whilst they were running, and then a few minutes later they were okay, and it was just put down as a faint and no action was taken. Or they may have been feeling more breathless than they should be when they did the same amount of exercise that they usually do. And that may have been put down to that person not being as fit as they usually are. But these might all be subtle warning signs that something might be wrong. And that's where the awareness is very important, where if something is not right, for example, if someone notices some fluttering in the chest, or a missed beat, or they notice that they're feeling more tired than they usually are, it's important to get checked out, because a lot of things, people might not recognize that feeling tired can actually be the symptom of a heart rhythm problem. And these might not be life-threatening problems, but it can be other problems. Like, for example, atrial fibrillation is a condition where people often come to me say that they're feeling so tired and breathless. This might not be life-threatening, but it's really affecting their quality of life. And it's because their heart is irregular. And a simple check of the pulse, where they just put their fingers on the pulse, might tell them that actually their heart rate, the pulse is not regular, and that could be the prompt to go and get checked out, get an ECG, and see a doctor.
Right. Now, in Sri Lanka, unfortunately, we have a lot of people who simply don't go and get themselves checked out regularly, and all of a sudden they have an issue and they're rushed to hospital. And it's only then that the tests are done, and very often it's then at an advanced stage. How do you do this preventatively? How often should you get yourself checked out?
Absolutely. That's where education is paramount. Awareness of your own health. Primarily, prevention is better than cure. So living a healthy lifestyle, good diet, plenty of exercise, eating clean and healthy, it's really important to prevent many heart diseases. But also some things are not preventable, and that's where good awareness of the possible symptoms, like the symptoms I mentioned, or for example, burning of the something where they might imagine that they've got heartburn. That could be a subtle sign that they've actually got a problem in the blood supply to the heart. Not everything presents classically, and therefore anything that's not right, it's important to get it checked out, but not to worry too much. If you've been checked out and you pay due diligence to your own health, it's important to then carry on with your life as normal.
Right. And what about lifestyle, Dr. Yanushi? Now, in Sri Lanka, unfortunately, many people just have very unhealthful lifestyles. We eat far too much rice. We also eat far too much in terms of breads. The malupangs and all that, especially nowadays, parents on their way to drop children in school will just stop at the neighborhood bakery. I think bakeries do most of their sales early morning. There's not much cooking at home. Both parents are working, and there's usually, especially in the Western province, there's a long commute to work in Colombo. So all those factors, and then of course we do tend to eat too much and not exercise enough. Again, cultural factor. I think people exercise when they're in school, they do sports, but then once they leave school, they don't do that much in terms of sports and exercise. So how do you impress on people that they need to take care of themselves much more?
Absolutely. Being a tropical country, we are blessed with an abundance of fruits and vegetables and so much variety of vegetables, and this needs to be ingrained from a young age itself. Children need to be able to appreciate the variety of textures and tastes that come with the vegetables and the fruits, and actually see that not as a secondary element on their plate, but really make sure that there is a host of different colors on their plate, because if you've got all the different colors and textures of it that come from within nature itself, you're having a healthy diet. And we've got the ocean all around us, we've got fish, and having plenty of fish, fruits, vegetables, and good amount of high quality protein in your diet is also very important. Especially as you grow older, you need to make sure that you have plenty of protein to make sure you maintain your muscle mass, and that keeps you fitter and healthier for longer. So that's all really important, to have a good balanced diet, not a diet that's heavy in the type of processed carbohydrates that you mentioned.
Right. Now, you mentioned that both young and old have heart diseases, but they can be somewhat different as well. Would you like to sort of categorize this for us?
Absolutely. So in younger people, I mentioned the inherited heart diseases, and that's where it's really important to speak to your parents and your elderly relatives as well to know about your family history. Because if there is a family history of sudden death in younger people, or if there's a history of unexplained accidents, and this might even be something that you don't necessarily associate with the heart. It might be someone who went out swimming and drowned just in a swimming pool, and there was no explanation to that. If they're a good swimmer, there's no reason why they should drown in a swimming pool. And that might be because they had an electrical problem in the heart that caused that event. And it's important to be aware of these things. And if there is an incident like that, then the immediate relatives do need to be screened for any potential heart problems.
Right. I don't think we do that much at all. It's everyone's got some relative who passed away young, and that could be for any number of reasons. So one needs to really zero in and see if it was something congenital.
And another thing might be unexplained car accidents.
Right.
If someone was sober and then they had a completely unexplained car accident, that might also be because of a primary heart rhythm.
Right. Now, Dr. Yanushi, in Sri Lanka, if a person passes away in hospital, there's generally no postmortem, and the body is handed over to the relatives and the funeral is held and so on. But if a person passes away outside of a hospital, usually the JMO, the Judicial Medical Officer, somebody gets involved in trying to ascertain whether it was foul play or not. But if they determine that it wasn't foul play, they don't necessarily probe very deeply into the cause. It's sort of glossed over. But in countries like the UK, it is looked into in much more detail, isn't it?
Absolutely. Once we establish if there's no cause of death, so after toxicology and after a full postmortem, if there's no cause of death, then we do a specialist cardiac postmortem in the UK, where we look at the heart in a lot of detail, because there could be a lot of clues to that death through that specialist cardiac postmortem. And that could be abnormalities of the heart muscle that I mentioned, or if the heart is completely normal, then the report is issued accordingly, and then it's the role of us cardiologists who work in inherited cardiac conditions to then investigate the family, because we can comprehensively investigate the family, and depending on the cohort we evaluate, up to 40% of people who have, of family members of people who have had a structurally normal heart at death, actually have a hidden heart rhythm disorder or a very subtle heart muscle disorder. And we can then put preventative measures like implant, for example, if they are very high risk, we implant defibrillators to prevent a similar tragedy happening in a sibling or a parent or a child.
So, Dr. Yanushi, there are many terms which cardiologists use, which the general public isn't very aware of. And we see these, of course, in medical reports and so on. But you have, terms such as arrhythmia, heart rhythm disorders, silent arrhythmias, atrial fibrillation, and so on. Could you explain some of these terms and what types of heart diseases that they actually indicate?
Arrhythmia is basically another term for heart rhythm disease. Atrial fibrillation that you mentioned is globally probably the most common heart rhythm disease, which is more common in older people. It's a condition that's actually fast becoming a cardiology epidemic, more so in the Western countries, and that's where it's because of people's diet, lifestyle, people being obese and overweight. It affects the heart muscle and the electrical system of the heart, such that the electrical system of the heart becomes very irregular and causes people to be, for example, tired or short of breath. And also they might be dizzy or have palpitations. And that's one of those most common acquired conditions of the heart. There are a few cases of inherited causes of that, but it's primarily a symptomatic problem where people's quality of life is affected. Whereas there are other heart rhythm problems, like, for example, a dangerously fast heart rhythm or dangerously slow heart rhythm, which can actually cause the heart to stop beating. And that's where that causes a cardiac arrest. So if the heart is dangerously slow, that's where we would implant a pacemaker to regulate the heartbeat and thereby stop a person collapsing or having a cardiac arrest. If the heart is dangerously fast, that's where we implant internal defibrillators that can internally shock the heart, detect and shock the heart if the heart goes into a dangerously fast rhythm, and thereby stop the person effectively dying, which can happen if it was not previously detected and treated with that defibrillator.
Right. But in all these conditions, early detection is key, isn't it?
Absolutely. Yes.
Right. And how does one detect or how would one suspect that one's heart needs some care, short of going to a hospital and getting the tests? You mentioned that just feeling your own pulse could be good enough. Anything else that people should look at?
When you exercise, and that's where we encourage people to exercise, so that if you exercise and if you're feeling unreasonably short of breath when you exercise, then that can be a sign that there's something wrong with the heart. Or if you get chest discomfort when you exercise and you have to stop exercise to make that discomfort go away, that's again a warning sign. Or if you feel dizzy, or even if you had one blackout whilst exercising, any blackout in the middle of exercise is a very critical symptom that should be a warning sign that you have to be tested. People can feel dizzy and faint after exercise. That's because of the body, that can be part of the body's adaptation and recovery from exercise. But anyone who blacks out in the middle of exercise should be checked out, because that can be a critical warning sign.
Right. Now, just because one has a heart problem or even has a heart attack, it doesn't mean you're going to die within a year or two or anything.
Absolutely not. Most heart problems are perfectly treatable, whether it be by lifestyle measures, medication, or intervention, procedures that we can do on the heart. And these are not necessarily surgery. All the procedures I do are intervention through the wrist, where we put catheters to the heart to treat heart rhythm problems, or by implanting defibrillators or pacemakers, which are just small devices which we implant in the chest, sometimes with wires going, most of the cases with wires going to the heart, that can treat these heart rhythm problems, which are essentially life-saving.
Right. But lifestyle changes, that's critical, isn't it? Because in Sri Lanka we eat far too much rice, far too many breads, and if you then have a heart problem detected in whatever manner, you need to actually change your lifestyle.
Absolutely, yes. Change your lifestyle and also be aware of other conditions which will affect the heart. A lot of people in Sri Lanka have diabetes, high blood pressure, high cholesterol. All of these conditions affect the heart. And a simple test is to check your weight. If you're overweight, then that's a sign that you should actually change your diet and lifestyle and take care of your weight, because that will ultimately impact on your heart.
Right. So a lot of wonderful advice coming from Dr. Yanushi. Now, what about when a person has a heart failure? The typical thing in Sri Lanka is to call the ambulance. And we do have a wonderful ambulance service nationwide now through this area. But in the past, people would just simply bundle you into a three-wheeler and rush you to the hospital. Now, it strikes me that not a lot of people in Sri Lanka actually know the first aid procedures for a heart problem, and CPR, cardiopulmonary resuscitation, is quite common. The training is quite common in the West, but in Sri Lanka we hardly have people who are trained in this. How does one get trained, and how long does it take to learn CPR?
Mm-hmm. It's great that you asked that question. And before I go into that, I'll touch on something I haven't mentioned so far, which is heart failure. You mentioned heart failure, which is another heart problem. Essentially, it means weak heart. Right. And a lot of people with heart failure live for many years with medication to help remodel that weak heart and to improve the heart muscle function. So that's something, again, that's not well understood, and it's one of those heart muscle diseases. Again, that could be inherited, but a lot are acquired problems of the heart. It could be because of lack of blood supply, as well as multiple other problems can cause heart failure. So that's a slightly different issue, and it's more of a chronic problem. But eventually, again, heart failure itself can cause primary electrical problems, which can cause a cardiac arrest, which is the situation that you mentioned. The cardiac arrest is when, due to an electrical problem in the heart, which might be because of lack of blood supply or because of a muscle problem or primary electrical problem, the heart just suddenly stops pumping. It's a dramatic event, and the person collapses, and basically there's no cardiac output, which is where people would panic, and people would immediately, the first reaction would be to call see if there's a doctor in the vicinity, and then do what you said, where they would try to take the person to the nearest hospital. But actually what saves the life is immediate CPR, immediate chest compressions. Chest compressions are vital, because the sooner you start the chest compressions, then you help to restore the blood supply to the brain. I've seen many cardiac arrest survivors in the UK because there is awareness of CPR. But unfortunately, even if that CPR hasn't been started early enough, because in the UK, the ambulance would get there, for example, within about 5 or 6 minutes, if there is a cardiac arrest, that 5 or 6 minutes would be enough to cause enough brain damage for that person to be paralyzed for life, unfortunately. So they might survive the incident, but there is irreversible damage to the brain. So every second, every minute counts. It's important to recognize if someone collapses suddenly. It might not be, it might be a simple faint. It might be something else. It might be, for example, a fit. But in all those cases, there would be a pulse. In a faint, there might be no pulse for maybe a few seconds, but the pulse would return. So the first thing is to check if the person is breathing, and check if there's a pulse. And if they've checked the pulse here and the carotid pulse, and if there's no pulse, start immediate CPR without hesitation while someone else calls for help to get that person to the nearest hospital or to call the paramedics. because the sooner you start CPR, you have a much better chance of giving that person a better chance of recovery from this. And the second most important thing is early defibrillation. So in the UK, we have publicly available defibrillators, automated defibrillators in sports grounds, in shopping centers, in gyms, where people might collapse. There's a defibrillator available within about 5 minutes. Someone can grab hold of the defibrillator and give that early shock, because if it's a shockable rhythm and you can deliver that shock early, then there is a chance that we would get that person out of that dangerous heart rhythm. So that's another important factor. So those two would require time. But CPR is something that anyone can learn.
How long does it take to learn CPR?
In schools in the UK, the British Heart Foundation, for example, would do sessions where they would go into the school, spend about 3 hours in the school, give one-to-one teaching to high school children to learn CPR. And in a morning or afternoon, about 100 high school children could learn CPR and be able to deliver that CPR safely.
Right.
So it doesn't take a lot of time. It just requires that infrastructure and the awareness and the desire to implement that.
Well, that's certainly something we should be including in our education curriculum, which is, of course, the hot topic these days, because education syllabus is being revamped. We need to take a short commercial break now. I am in conversation with Dr. Yanushi Dullewe Wijeyeratne, and don't go away. We'll be right back after these messages.
There's never been a more important time to stay up to date and in the know.
At Bondi Beach, the feeling of grief and unease still lingers.
Every weeknight, we bring you the biggest international news from around the globe.
Washington says it will also take control of Venezuela's vast oil reserves.
So join me, Giris Saulani, for the latest stories in your world.
Rarely in the Islamic Republic's history has it appeared so vulnerable.
The world.
මේ හරිස් චන්ද්‍රගේ පවුලේ උදවිය.
චන්දු එන්නකෝ සජිනී
අප්පච්චි අපේ ෆිල්ම් එකේ ෂූටින් පටන් ගන්නේ කවද්ද?
මම පටන් ගන්න ඕනේ.
මේ දැන් කවුද එතකොට ඕකේ මේන් රෝල් එක කරන්නේ? අක්කෝ යහනේ කොල්ලා කවුද කියලා.
විශාකලාගේ පවුලේ උදවිය.
අපට ෂේන් නැති වෙලා දැන් අවුරුදු 8ක් වෙනවා විසක. දැන් අවුරුදු 7ක්ම අපි ෂේන් වලදාලා ඉන්නේ කොතනද කියලා දන්නේවත් නැතුව.
ෂේන් කියන්නේ මගේ දරුවා. මම ෂේන්ගේ අම්මා පාලි.
දැන් ඔබේ පවුලේ උදවියත් එක්ක ළඟම සිනමා හලට ඇවිත් බලන්න. ධර්ම යුද්ධය 2.
ගමනේ අපේ දෛනික ජීවිතය සවි බල ගන්නවා.
ප්‍රවාහන හා ගමනාගමන අවශ්‍යතාව ආණ්ඩුව විසින් අවධානය යොමු කරන්න ඕන.
අපි කියන්නේ බස් රථයකට අලුතෙන් තහඩුවක් අය කිරීමවත් නෙවෙයි කරුවේතනේ.
මිනිස්සුන්ට පෞද්ගලික රථ වාහන මිලට ගැනීමට අවස්ථාව සලසා දීම. ඕක තමයි ලංකාවේ සමස්ත මධ්‍යම පාන්තිකයාගේ ජීවිත කතාව.
Sirasa debater with AAT Sri Lanka.
ඉරිදා සවස 6ට.
Welcome back to Face to Face. I am in conversation with Dr. Yanushi Dullewe Wijeyeratne to tell our viewers a little bit more about Dr. Yanushi. She was born and grew up in Sri Lanka and then moved to the UK for her university studies. She is right now, her work is focusing on identifying and treating complex arrhythmias and genetic heart diseases that can lead to sudden cardiac death, often in people with no prior warning. Now, She's a clinical lecturer at City St. George's University of London, and has trained at some of the most renowned cardiac centers, including St. George's, King's College Hospital, and the Royal Brompton Hospital in London. She graduated in medicine from the University of Nottingham and became a member of the Royal College of Physicians in 2013. In recognition of her clinical excellence, her leadership, and her commitment to advancing cardiovascular care, she has been awarded Fellowship of the European Society of Cardiology, which is one of the highest professional honors in cardiology, reserved for those making a sustained contribution to reducing the global burden of heart disease. Dr. Yanushi has received international recognition within her field, chairing many scientific sessions, presenting research, and delivering lectures at major global conferences. These include the European Society of Cardiology, the Heart Rhythm Society in the United States, the European Heart Rhythm Association, and the British Heart Rhythm Congress. And she also serves as the sole UK representative on the EHRA Young Electrophysiologists Committee, which reflects her influence among the next generation of global cardiac leaders. Apart from her initial qualifications in medicine, she also holds a PhD in inherited arrhythmia syndromes, where she's done some groundbreaking research combining genetics, clinical cardiology, and advanced laboratory science. So she has, in fact, had a very distinguished career despite her youthful appearance. So it's a pleasure having you on the show, Dr. Yanushi. Now,
thank you. Thank you for that kind introduction.
Right. So, Dr. Yanushi, now when you compare advanced nations such as the UK, the United States, and then you compare Sri Lanka, which you're very familiar with as well. Sri Lanka has an excellent public health system, which is held up as an example to the rest of the developing world. But we don't have the advanced systems which you have in the West. How difficult or easy is it to implement these advances into our system? And over the last few decades, medical science and other sciences have, advanced by leaps and bounds. So how does one sort of improve the system? And is it simply a matter of learning, or how do you go about that?
I think what's crucial is public education and awareness, and people taking responsibility for their own health.
Right.
Because
that's an interesting answer.
It's not about
the doctors or the hospitals as much as it is about people.
It's both.
Yes.
Side by side. You can't go to a specialist and expect the specialist to take care of everything. Even when I treat patients, I can, for example, atrial fibrillation, I can ablate atrial fibrillation, but if the person goes on to not modify their diet and not lose weight, then the chance of that coming back within the next 2 to 3 years are very, very high. So I can always say, or even if someone has coronary artery disease, and people might say that they had a triple bypass or a quadruple bypass, or that they had 2 stents inserted. But that's only so much that we can do as cardiologists or cardiac surgeons. Because the ultimate responsibility for your health lies with you. It lies with you to then modify your lifestyle, make sure you take all your medications as prescribed, and modifying your lifestyle to prevent the same problem recurring in a few years' time.
Interesting, and that's a very interesting answer indeed. So one needs to take care of oneself and those around you much more. And you spoke about awareness creation. Again, it's not really the responsibility of the state and the schools alone, is it? In today's day and age, with the internet at everyone's fingertips, there's a wealth of knowledge out there, isn't it?
Yes and no, because there can be unreliable sources, right, and also self-diagnosis can be very dangerous.
Right.
So it's important to be aware of the potential problems, potential symptoms, but always seek the advice of a professional, because people there can be a lot of fear-mongering on the internet. There could be a lot of exaggeration of symptoms, and something that might be completely harmless could be depicted as something dangerous when it's not, or people can misinterpret something that's potentially dangerous as being potentially harmless. So every case is different, and that's where it's important to seek a professional. The internet can never replace that professional expertise.
Right. Now you mentioned self-diagnosis, and this is something I think a lot of Sri Lankans are guilty of, because you have the similarities between gastritis and a heart problem. And unfortunately, many Sri Lankans suffer from gastric disorders, so they tend to confuse the two, don't they?
Absolutely, yes. And that's why if you have a symptom and you're not sure of it, it's important to get checked out rather than seeking the opinions of people around you who might not necessarily be professionals, or even if they're professionals, they haven't, a colleague or an acquaintance wouldn't be evaluating you in the same way that a professional would, wouldn't have access to all the tests that a professional would advise you to take. So that sort of third-hand opinions is not a good idea. It's best to always have a one-to-one consultation with a professional if you're concerned, even if you've got heartburn. That might be an early warning sign of a heart problem, or it might be a warning sign of a different gastric problem, which could even be a potentially very serious gastric problem. So that's why it's important to have appropriate evaluation.
Right. Now we mentioned the massive and amazing advances in medical science. And you are at the forefront of a lot of this. Could you tell us a bit more about the research you are doing over there in London? And bear in mind that our audience are not medical professionals, but I'm sure you'll be able to explain it in simple terms.
Absolutely. So my research is about preventing sudden death in young people, and how we better evaluate inherited heart conditions in people, and doing genetic studies to study not only straightforward genetic inheritance, but I'm also investigating common genetic variants that can influence sudden death. So sometimes people might have a certain genetic disorder that can present in different ways in different family members, even if they carry that same genetic problem. But that might be because the common genetic variation that you or I have can actually influence how that particular known genetic condition manifests in people, and that's what I investigate, and thereby that can be used to treat the wider population. So that's one aspect of the work I do, and then also how we better determine the appropriate treatments for these people. For example, the different types of cardiac devices that I mentioned that can be used to treat people with heart rhythm problems. There are newer cardiac devices that are being used, which might be more appropriate for certain types of patients than others.
Interesting. So into the latest advances and technology, and how quickly do these things advance? I mean, you know, the knowledge that perhaps you learned in medical school would be, you know, quite obsolete now. Do you have to keep abreast of it all the time, or how does that work?
I wouldn't say that the fundamentals of medicine ever become obsolete, and that's the foundation for all the newer things we do. And a lot of the treatments are probably the same as it was many years ago. It's the subtleties that change over time, and the newer technologies come in, but the fundamentals of what we do remain the basis of the newer treatments that we are developing.
Right, interesting indeed. And tell us a little bit about the hospital that you're working at primarily.
Mm-hmm. So I work at City St George's, University of London, and the Royal Brompton Hospital. And at the Royal Brompton Hospital, we're at the forefront of some of these newer devices that I mentioned to you, because, for example, I mentioned defibrillators.
Right.
Traditionally, the defibrillators we implant into patients' bodies have wires that go into the heart to shock the heart if the heart goes into a dangerously fast rhythm. But the newer defibrillators we implant don't necessarily have wires going into the heart. They're still internal, but they can shock the heart without the wires, because the wires can have long-term complications. We implant these devices in young patients who are in their 20s or 30s. And if you imagine metal being in the body for 50 or 60 years, can have problems down the line. So we are implanting these newer devices which avoid that problem, because they can treat the heart without actually having metal components that go inside the heart. Another type of device that we use, that we are increasingly using, are pacemakers that aim to mimic the natural electrical flow within the heart, and thereby prevent some of the problems that the traditional pacemakers used to have, which can, for example, if a person is dependent on a pacemaker, it can weaken the heart, because the pacemaker paces the heart with a different configuration to the natural electrical system of the heart. That's called conduction system pacing. And again, the Royal Brompton Hospital are at the forefront of those pacemakers. So there's a lot of exciting innovation happening within cardiology, and that's where I've got the expertise of that, along with the research that I do in patients with inherited cardiac conditions at St George's, University of London.
Sounds quite exciting indeed.
Absolutely.
Right. And I'm afraid we're almost out of time. So I'm going to ask you, Dr. Yanushi, to give our viewers some advice on what they should do and what they shouldn't do, and hopefully they can make some lifestyle changes and live healthier, happier lives.
Absolutely. My primary advice would be to take control of your health, to have an awareness of not only your personal history, but also your family history. And if there is anything suspicious in your family history, like what I mentioned, for example, if there have been any family members who have died suddenly at a young age, or in your personal history, if there have been any unexplained collapses, unexplained blackouts, or if you're feeling short of breath for no reason, or if your exercise tolerance is less now than it was a few months or years ago, then make sure that you get checked out.
Right, some excellent advice indeed, and I'm afraid we're out of time. My thanks to Dr. Yanushi Dullewe Wijeyeratne for some excellent advice, which I'm sure all our viewers can benefit from in a major fashion, and live much healthier and longer lives. Thank you very much for joining me this evening, Dr. Yanushi.
It's my pleasure. Thank you for inviting me.
Right, and I do hope that the next time you are in Colombo, you will drop by and give us some of the latest news in this field. Right, and thank you very much to you at home for watching. Don't go away because the news is coming up next. Have a great evening.